It still gets to me, you know, all those people that I knew that died, and I'm still here. And sometimes it is survivor's guilt. I am living with HIV since 1987, and I'm 63 years of age. I'm a transgender woman, so I was going for surgery. And it was compulsory to get a HIV test or AIDS test back in the day, you know. So I went for it and I just thought, I'll be fine. So when I went back for my results and I was brought into a little room and I was told that I had AIDS and possibly 2 years to live. So my whole world fell apart very rapidly. And I told my family. And I think my family, it was just a little bridge too far because they had just they were trying to get their whole head around the transitioning thing. All my friends, so-called friends from then, were gone. People just kept kind of going away from me.
You know, I had a family member that I never got to meet that, you know, died of either AIDS or some sort of complication relating to that. And what shocks me is obviously, like, I never even met him. I didn't have even a personal relationship with this person yet. Just the fact that I had someone in my family that I never got to meet because of this, which is something that I can avoid so easily now. And that wasn't a privilege that he had. You know, I was in the closet. I didn't have anyone that I could look up to in my immediate family as a gay role model and know that it was okay to come out. I had no idea what my family would do in terms of reacting to me being gay, or I'd never seen how they interacted with a gay person. There was no immediate friend of the family that was gay, there was no family member. And obviously I feel slightly robbed.
There have been a few great successes in recent years. So the number of diagnoses among gay and bisexual men and other men who are sex with men have been falling consistently for several years now. Partly that's because the messaging is getting out there about how to protect yourself and how to, you know, what you need to do in order to test and get onto treatment and achieve an undetectable viral load. But one huge thing is PrEP. So we know a lot of gay and bisexual men who are particularly in urban areas and in high-risk communities are on PrEP, and that is really bringing down the diagnosis rates. So PrEP is a pre-exposure prophylaxis. It's a pill that you take if you're HIV negative and you want to stay HIV negative, and if taken correctly, it can prevent you from acquiring HIV.
PrEP was something that I was completely ignorant to. I didn't know anything about it until a friend had told me. I sort of looked at him quite blankly when he said PrEP and just thought, what is that? I did not know it existed, quite frankly. I didn't know that we had something that could prevent contracting HIV. It's so easy, it's once a day, or if you're not, you know, so sexually active and you can predict, you know, you're going out on the weekend, then take it twice, 24 hours before, once 24 hours thereafter, and again. That's easy. I'm so glad that I now know about it and that I've been speaking about it. There's no shame in me saying that I'm on PrEP. And equally, I think there's no shame for some people that I know that have HIV, that they have HIV, and that it's now undetectable in their system, and that they're not going to pass it on. You know, it's not just PrEP, it's across the board. The advances we've made, I think, the reason that gets to me is just because it's like, if I'd been born 20 years earlier, my life would have been completely different. And that's such a terrifying prospect, but also it fills me with such like a privilege.
I suppose what has changed with a lot of people, like now I'm on 2 tablets a day, you know, and that's because of my resistance. But I'm lucky that I'm, you know, only on 2 tablets a day. But like most people that are diagnosed now, or in the last kind of couple of years, you know, it's 1 tablet a day. You know, it's the same as PrEP or something. You know, it's the same amount, you know, you take 1 tablet a day. So I think it's the simplicity of the medication. I think then it simplifies, it makes it easier to kind of tell a story about it. Do you know what I mean?
I was diagnosed because my GP sent for an HIV test. You know, it wasn't at a GUM clinic. We've got other speakers in our program who were diagnosed as a result of opt-out testing in A&E. Those kind of things will be really key, particularly to get into those communities that that haven't been at high risk for HIV, but we know there still is some undiagnosed HIV in those communities. And widening access to testing is the thing that's going to get us, to those 2030 goals.
I think just recently we saw an article come out that more heterosexuals are contracting HIV now than the homosexual community. So like it being oriented towards us and marketed in that way maybe isn't the right strategy. Maybe it needs to now go for everyone.
I always say HIV is not fussy. It doesn't care what color, gender, how much money you earn. It does not care. It really doesn't discriminate. It doesn't pick anybody out, And we need other people if we want to get to somewhere that the zero in 30 years, whatever in 10 years, well, then we need to reach to everyone.